Welcome to training on medication management for disability services. I'm Bev Meldrum. I'm a registered nurse and my role within Uniting is as the Learning Development Manager. To start off with, we'll just do acknowledgement to country. We acknowledge all ancestral lands of Australia's First People and recognise their continuing connection to land, water and community. To our Aboriginal custodians, we acknowledge we are on their country and pay our respects to their elders, past and present, and extend that respect to their young people who will continue to nurture this land and preserve the oldest continuing culture on the planet. Today, we're going to learn about medications, what they are, roles and responsibilities of medication administration, the 6 R's of medication administration, medication contingencies, and storage and disposal of medications. Medications can be described as any pharmaceutical substance which alters the natural state of an individual and which can be administered via a variety of routes. These can range from herbal extracts and vitamins to synthetic chemicals. They come in many forms and may be ingested, inhaled, inserted or applied. Duty of care is defined as a moral or legal obligation to ensure the safety or well-being of others. For workers, it means that they must provide a standard of care that does not put participants in harm's way and that all reasonable care was taken to reduce harm. Duty of care applies to medications in that you need to take care with the tasks you are doing. You need to notice health conditions and report them and respond appropriately to issues that arise and report those issues as you see them. In regard to medications, the roles and responsibilities include assessing and minimising risk. This may be according to the participant's needs, it may be the risks in the environment. You also need to understand your responsibilities, and these will be outlined in our policies and procedures, but also contained within your job descriptions and instructions given by your supervisors in the workplace. You need to work within your scope of practice and training, meaning that you should be only doing what you are trained to do and what you know how to do safely. You need to report and record all changes and discrepancies, and you need to participate in training on a regular basis to make sure that you keep up to date with your knowledge and skills. In regard to medications, the medication policy and procedures are located on the Uniting Policy and Procedure SharePoint site. And for our disability services, there are a number of policies and procedures that are written specifically for those services, and the medication procedure is one of those. Staff must be familiar with the policy in regard to safe medication administration, storage and management, and they need to know how to access these. When giving medications, we need to make sure that we adhere to the 6 rights. We need to make sure that we've got the right person, the right medication, the right dose, the right time, the right route, and the right documentation. There is another right that we talk about, and that's the right to refuse. Participants have the right to refuse any medication. However, all refusals must be documented on the medication chart, and the procedure must be followed in regard to reporting and passing that information on. So to start with those rights, when we talk about the right person, we need to make sure that we correctly identify the participant. We need to ask them to identify themselves. Call them by name. We need to look at them, to recognise them. Look at the photograph contained within the medication charts. Is it the same? Look at the photo that's on the blister pack. Do they all match? Look at the details that are recorded on those charts and on those packs. If you're not able to confirm the identity of the participant, then you must consult with the team leader or the person on call before proceeding with assisting to administer that medication. Before you give a medication, you need to identify yourself to the participant. Hi Joan, my name is Layla and I'm here to help you with your medication today. How are you? So greeting the person and introducing yourself is an important part of person-centred practice. You may already know the participant that you're working with and it may not be necessary to introduce yourself again. You may, however, wish to ask them how they're feeling or what they've done today. Having a conversation may alert you to any problems that they might have and any reasons why you may not give that medication. You may discover something that needs to be reported to your team leader before they have the medication. Observation is an important part of any staff member's role. When talking to the participant, also observe for any signs that might indicate that they're not feeling well or that there is a change in their usual health status. If you notice anything that might alert you to an illness or a change in health, you need to alert your team leader or the person on call before assisting with any medications. Timing of medications is also really important. Many medications need to be given at a specific time to ensure that the medication doses are spaced sufficiently apart. This will help to maintain the required blood levels for effective management of their symptoms. They may need to coincide with the consumption of food so that the medication doesn't irritate the stomach. Timing may also be used to minimise the interaction with other drugs that have been prescribed, or it may be to avoid meal times so that the medications are given on an empty stomach. We also need to make sure that we're checking the medication. We need to check the packaging to make sure that it is correct. We check the information that is written on the packaging. Look at the photo, look at the person's name. The medications will be listed on the back of the packaging. Are the seals broken on the back of the packet? If the seals are broken on a medication packet, then you can't give the medication. Look at the quality of the medication. Has it disintegrated? If it has, then you can't give that medication. Check the expiry dates. All medications will have an expiry date written on the packet. If the medication has expired, then you can't give the medication. Staff giving medications must have the medications packed in a dose administration aid. It is also really important to check that you're assisting the participant in the right manner to enable them to take the medication. You may also notice that the participant's medication has dramatically increased or decreased in dosage. If you are concerned about this, then you must talk to the team leader or your person on call before you give the medication. Trigger labels are also available to be attached to medication charts and to Webster packs. The trigger labels are available from pharmacies and can be ordered from the pharmacy. It's really important that you read the detail recorded on the medication chart. This will tell you how the participants take their medication, whether they need to have them with a full glass of water, whether they need to have them with their meals, whether medications need to be crushed, whether you need to watch them closely. Any habits that they have when they take medications should be recorded on the medication chart. The medication chart will tell you the name of the medication that they're having. It will tell you how often they're having that medication. The doctor's signature should be on that chart. And it will tell you the route. So PO means per oral, and that will be recorded on the medication chart. Occasionally, participants may have problems swallowing medication, and we may need to crush the medication. Staff cannot crush or alter a form of medication without consulting with the pharmacist or the doctor. And that would then be recorded on the medication chart. Not all medications are safe to be crushed. You need to consult with the team leader or the person on call if a participant needs to have a medication crushed or changed to a liquid form. If you're unsure, then you need to check with the team leader before crushing any medication. Some medications have a special coating on them which protects the gastrointestinal tract from the medication. It will delay absorption of that medication. If you crush the coating on the outside, it will change the absorption rate of the medication, which can result in the participant having an overdose of medication. It can result in gastrointestinal issues. It can make the tablets taste. The taste can be quite awful for some medications. So the coating will actually disguise the taste of the medication. And some medications can react to touch. So the coating will help to protect the skin from the effects of those medications. If a participant needs to have a medication crushed, then the box must be ticked on the medication chart so that staff are informed that that is safe to crush that medication. If a medication can't be crushed, then it can't be broken in half either. Any change to the medication form must be ordered by the pharmacist and it must be recorded on the chart. Otherwise, staff can't do that. Documentation for medication is vital to provide evidence of what has been given and what hasn't been given. The medication profile is issued by pharmacy. This is to be scanned and uploaded in the participant's CareLink file, and for accommodation settings, it's placed in the hard copy file by the team member who supported the participant to the health appointment. We also have Webster medication charts. These are also issued by pharmacy. For accommodation settings, this is to be stored in nominated, lockable, safe location within the household. There is also the health and wellbeing plans. This is to be scanned and uploaded into CareLink against the participant's file and placed in the participant's hard copy file by their key worker. Consumer medicine information sheets for every medication the participant is having will be issued by the pharmacy. This is to be scanned and uploaded to the participant's CareLink file and for accommodation settings placed in hard copy file by the team member who supported the participant to the health appointment. PRN, pain and/or chemical restraint medications must be scanned and uploaded to the participant's CareLink file and once again for accommodation settings placed in the hard copy file by the team member who supported the participant to the health appointment. We also have medication movement registers which are also completed when a medication is received or removed. All medication administration must be documented immediately after it has been administered. Where possible, a second person must sign that they have witnessed the administration. Any medication that has not been given must be documented with the reason why it was withheld. PRN medication must be documented to outline why it was given and what the effect of the medication was. Never document that you have given a medication until you have actually administered it. Missignatures could result in medication errors such as overdosing. If you did not administer or witness, you do not sign. All medication charts must have the participant's full name, their date of birth, any allergies, an identifying photograph, the month the chart was completed, the year that the chart was completed, and precise dose and administration instructions. Allergies are to include both medication and non-medication allergies. The photograph should be current and look like the participant. Staff are to update these when health and wellbeing charts are updated annually. All prescriptions must show the participant's name, the name and form of the medication, including the strength and dose, the route, the dose stating the milligrams or mils to be given for dose and frequency of administration, and if required to state a maximum daily dose, the date of the medication order and the stop date if it's a short-term medication such as an antibiotic, any special instructions such as do not crush or to give after food or with food should be recorded, and PRN medications must specifically state for what reason or condition the medication is to be given, the dose, the frequency, the maximum daily dose and route. The participant chart will give you all the details of the participant, and any medication instructions will be recorded on here. Their allergies, their date of birth and the doctor that is ordering the medication will be outlined on the identification chart. The medication order sheet is completed by the doctor. When a medication is new, changed or updated, the pharmacy needs to be alerted and the team need to be informed. The doctor must sign the medication charts. The medication order sheet will outline the participant, their name, their date of birth, their age. The medications ordered will be listed, the dose will be listed, a picture of the medication will be contained within the chart, and the route that the medication needs to be given will also be included on the medication chart. All participants will also have a medication sign sheet. All sign sheets must be completed as they are administered, and if possible, 2 staff must record the medications that have been administered. They will also have a photo of the participant and pictures of the tablets so that you can identify the tablets that are contained within the pack. There are separate areas for different times for medication. Before breakfast, at breakfast, before lunch, lunchtime, before supper and supper time. So you need to make sure that you're signing in the correct space. So a signature, and then in this line, the number of doses. How many tablets did you give? A total of 2, a total of 5. However many tablets you gave will be recorded in the line down here. Signature next to the medication, and the second person can sign down the bottom as well. Medication administration is a very important responsibility, and it is really important that you double check what you're giving. You need to read the label on the packaging 3 times before you remove from the storage, before you begin preparation of the medication, after you've finished the preparation of the medication, and before you give it to the participant. Each staff member should be checking the medications that have been administered correctly each time they are on shift.